there's other dentists, like you said, that you felt like that you don't like the financial part. You don't like it. Delegate it. Give it to someone else that does it well. That keeps your financial in.
But that is
that's another thing that dentists are very bad at. Delegate. Yeah.
Exactly. That is something that should be mentioned. I totally agree with you, because at the universities we're not prepared for all the information. And I was thinking this morning that that question that I wrote to you that you will answer later, what would you say your younger self, if you were to your younger 20 years old? And I was thinking about that question, and I realized that I would not listen to any advice. I was really like, this is my way. I believe in my goals and I will follow them. It doesn't matter what anybody would say. So even if they would say something, I think I told you that the first time I heard about that the dentist is in a risk group of depression and burnout was about 2 weeks before I graduated. And I remember that it was the psychologist oriented dentist at the university. And he said, yeah, in 2 weeks, you have finished dentistry. And now I'm going to tell you that you will belong to a risk group, high risk group of burnout, drug addiction, alcoholism. And we were sitting there like, what is he saying? But I really thought that it's not me, because I had 2 small children. I studied with 2 small children. I had extra work. I was a real warrior, you know. I finished this with all difficulties, but I didn't have to repeat any test, or I just managed it without problems because I was a fighter. But now, all this, I realize it's exactly the group that will suffer from burnout. It's the persons, first of all, people pleaser. But then when you fall, you stand up again. You fall, you stand up again without doing the changes. You don't listen to yourself. You're not self-aware. You just fight like a warrior.
I have to do this. 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 Yeah.
Yeah. Exactly. And also, when I have read the last months about high sensitive persons, they can be successful. They are seen in the society as one of the most successful people, but also patients with depression in the hospitals. So the line is so fine between being here, if you follow your inner values and passions and happiness, or you can be here, you can be depressed. And as you know, and as I'm going, I have been through burnout periods, and I was a completely different person. You have seen me when I was bad. I have been here, and now I'm here. That change is just, the only change is I followed my happiness. Then I came here. When I'm not following my inner values, then I go here. And that is why we have to speak about it, because in dentistry, all the high sensitive persons, they are the ones that are in the high risk group. And I think I told you that I sent mails to 12 different universities, and just one answered. It could have several explanations why the other didn't answer. Maybe it was the wrong person seeing the mail, but that university who answered, it was a psychologist at that university, and he said that they are working with mentorship, and they are working with a model that is called vulnerability stress model, because we know that in dentistry, there is a lot of stress. And if you are a person who is vulnerable, and you are a person that is vulnerable if you live based on emotions, because you have to please 20 to 30 persons every day because you're a pleaser. So if you don't have any education in that, it's like letting a soldier run out in the war without having any protection. So this subject is so important because, as you said, dentistry is a beautiful profession. But if you don't teach these small things, it could be lethal. It could be really harming a person. But I think also that we are so afraid. We have to speak up about it because there is so much stigma. There are no profession that is so proud as dentists. We are proud of our profession, and people come to us for help. So who are we to seek help? It takes a lot. I was not even aware that I had a burnout that was going toward a depression. I was not even aware, Manuela. Can you imagine? And I like psychology, but I couldn't see myself getting depressed, but I was starting to see everything negative. And you could see it clearly when you saw me that day. And we just have to remove the stigma because it's the opposite. It's the strong. I can really recommend a book that is called Depressive Illness of the Strong. His name is Dr. Tim Cantifer. That book is a game changer. He could tell when he has a patient with burnout or depression, before the patient starts to speak, he says, I will tell you the 9 characteristics of your personality. And he said, it's every time the same. It's patience with high moral, people pleaser, continuing, even if it's hard, you continue, you fall, you stand up again, and you continue. Your profession is very connected to your personality. So if you fail in work, you feel that you're failing as a human being. What you say, you keep your word. So it's really nice. I mean, for the patients, it is the perfect. And that's why we are also very appreciated in our job. And that's why we don't want to speak about depression and burnout because we're afraid of losing our patients, but we are staying because of the love of our patients. So it's such a complicated subject, but we just have to speak about it. It's very complex, but we can only solve it if we're speaking about it. And when I have not speaking with one dentist that hasn't said, yeah, I have been there too. Every single dentist I have been speaking with, it doesn't matter if they were high sensitive persons or not, they have said that they have had periods of burnout at least. But the burnout can lead, if you don't change, it will lead to depression. If it doesn't change, if you don't change your life, it could lead to chronic depression. And there you don't want to be, because there is when you cannot lift yourself from the bed and you have to go on medications. So when I realized that, I was like, no way I'm going to be like that and go on medications. I have to change my life. So that was the point. And that's what I wanted to say. Do you remember the day, Manuela, when you realized that you had to change? Because many times it's like a special moment when you realize.
I told you in the beginning, what led me to change was that episode that I really understood that I needed to change my life when I got back to work. So I stopped changing. I stopped working 6 days a week. I stopped working from 9 to 9, and I started looking for tools, to deal with the stress of the profession. And that led me, of course, I already had started because during my surgery, I had psychological support. So I was already started with the psychotherapy journey, and I started going to. Of course, I started to. Looking for other tools, and that led me to mindfulness. That's when I did my first stress reduction course based on mindfulness. I discovered retreats, silent retreats, which is something that for me, silence is one of the tools that I have also to connect with myself. I really started to really have this body-mind connection, and I started to realize that a lot of things that I did in my life, it was because my mind told me to. It's that to be in that mindset that you were just describing before. I have to do this. I have to do this. And I start questioning myself. Why do I have to do this? It's because who told me I had to do this? No, I don't want to do this. For example, I discovered that something that I forced myself to do that I hated, but I thought I had to do it, was to go to the gym. I hate the gym. So I discovered what physical activities connect with me. And it's a completely different thing. I don't like the gym. I don't like to lift weights. Don't like that. It's not for me. And I forced myself to do it because that's what a successful person do. So I did that. I took care of myself like it was in my to-do list. It was just a check in my to-do list. I even tried, which is not also for me, to know that morning ritual. I hear miracle morning. I read miracle mornings, and I'm not a morning person. I'm one of the things for success for me nowadays is I don't have an alarm clock. I have when I'm in the city, when I'm giving courses, when I still do certain work, or when I work with colleagues that are in a different time zone. But then I don't need an alarm clock, and my body naturally wakes up between 7:30 and 8 o'clock. So miracle mornings don't work for me, and I'm a big advocate of that, of discovering what works for you, of your body, because we are all physiologically different. It's like meditation. It does not work for some people, and you need an active different kind of meditation, but it has to be adapted to you, not you adapted to these techniques, and sometimes you are even a slave of personal development, which also does not work. So for me, the moment of the turning point was my sickness, and then that led me to conscious choices, which eventually led me to leave Portugal and go work in Belgium. And I started to I wanted more from dentistry. I really wanted more from dentistry. And I knew it was not only that, I already had completely changed the way that I work in a clinical way. I was only working 4 days a week already, only things that I started to delegate. I started to really to set boundaries. And then in Belgium already, I went to a course of mindfulness into the dental clinic. So they have this course in Belgium also. So it's like we were saying before, these things are changing. These courses are out there. Universities are already doing work. They have already the psychology department, and that's we have, of course, to continue to talk about, to raise awareness and among dentists, because it's like you said, it's not talked. But I have a lot of hope in this new generation. They are much well prepared than us. But me, I went to this course in Belgium, which was mindfulness in the dental clinic, and because I already had the mindfulness practice of many years, I ended up speaking to this person in the end, and he told me, and I told him this feeling that I had, that I wanted more from dentistry, or maybe I have to change. I have to stop being a dentist. And he told me, Manuela, you are telling me things that usually dentists tell me when they are 60 years old. So you are not even 40. I was not even 40 at the time. You are not even 40. You are 20 years ahead of them. Go ahead, discover your follow your passion. And maybe you have a practice of this. Maybe you can specialize. Maybe you can integrate these two worlds together. And that's what I did. I went deep on it. I started doing courses. I applied for the mindfulness-based stress reduction teacher training. It was 2 years until I had the courage and the confidence to say, okay, I'm going to start teaching mindfulness to dentists. But everything flowed very naturally. It was never like I was able to disconnect from that voice in my mind of I have to do this. So that's not the way I work nowadays. And when I say to myself, you have to do this, there's already a red flag in my brain, so okay, why do you have to do this? Of course, that I did a lot of coaching also. I have several coaches. I have to discover other completely different areas like marketing, for example. But it's been a discovery. It still is. It's like in the beginning what she said, we are always learning. But the turning point for me, it was my me being sick. And usually what I observe with dentists is that the turning point comes from suffering. It needs a lot of suffering for you, just like you described your process. That's a lot of suffering, and Christina, that you described. It's not easy. We talked about after and more lightly, because we are able to find that happiness that you described. But it takes a lot of suffering. So, and that's why sometimes dentists have this resistance, to do the process, because they know it's a bumpy road. It's a bumpy road. You get there. There's life after the rainbow, but it's a bumpy road. But what I try to do with my work is for this process on dentists to be as a preventive work, for them not to reach the suffering part that exhausts them and that leads them to burnout. So I would like for dentists to have these tools before they reach that.
But how do they find it? Because me personally, I'm a person that I don't change, or I have changed now the later years, or months, but I had to suffer until I realized, my personality was like boom, boom, boom. I hit my head, but not until I really fell hard. Then I realized, okay, now something has to change. So how do you reach the persons that has not gone through the burnout yet, has not reached the burnout yet? How do you reach out to them?
Well, you have to do this work that we are doing here. Of course, you have to talk about this subject. You have to bring the awareness. I think that nowadays there's already a big awareness for mental health and also for personal development. I think that nowadays it's already you already understand that for you to have success, and here I'm talking about success as a person. Right? For you to feel fulfillment with your life, happiness with your life, you have to also invest in your personal development. You have also to develop certain tools. Even happiness is a skill. I mean, these are all skills. These are human skills, of course. Like Simon Sinek says, he doesn't like to call them soft skills. He calls them human skills. And like all skills, this can be learned, trained, and developed. So I think there's a lot of awareness already for dentists to that. And then you talk about these things. Like you said, these things cannot be under you cannot hide them anymore under the rug. I mean, dentistry, like you said, is such an emotional profession. How can we leave our emotions out of the equation? That's not possible. Emotions are information. They are so useful. They get your job so much richer. So don't close yourself. Don't work with the mask. There's this idea of dentists having a social mask. That's very old-fashioned. Also, we have to deconstruct that idea. Bring your authentic self. Be yourself. When you do the job, you will have much more meaningful connections. Do invest in good boundaries and systems and protocols that if you are a people pleaser, that will make your life much easier. It will give you save time and drama, and it give you time for creativity and for the fun part of the work. But answering to your question, one of the things that I've learned after doing this job already for I've been teaching mindfulness and emotional intelligence to dentists already since 2018. So I've already came to some conclusions, and one of them is that you cannot find people. People will find you. So the work that I do works because when they are ready, they commit on doing the work. I can say to you, look, dentistry is a high-risk profession of burnout. Are you happy what you do? No. But if the person is not ready to do the work, there's nothing I can do. So you cannot force anyone to do it. It's only when you are prepared. It's like when you read a book. Sometimes the information makes sense in a cognitive way in your mind, but you really don't feel it. And then you read the book a second time or a third time, and you have this aha moment, this insight. But it's not the first time that you hear this information. But now you are ready to receive it.
Exactly. But you're mature. You're ready to receive it. Perfect. Yeah.
It's not a question of maturity. It's a question of, when you are in life, and sometimes it needs suffering for you to be ready for that information. So I learned that because in the beginning I was very eager for, but they need this. Why don't they do my course? The first course that I organized, I had like one participant, and I gave the course for that one participant, and it was really, it taught me a lot of things, because I discovered that I love to do one-to-one mentoring. It's so much richer, but the group work is also very rich, because networking in dentistry, for you to understand that you are not the only one feeling that way, is so powerful. It's very powerful.
Exactly.
But
that's what I wanted.
In the beginning,
sorry
I was so...
When you were speaking about the man, you told that you wanted something more of dentistry, and I was thinking about, it's so important to speak when you have a feeling, because that could be the right person who gives you a feedback or gives you a contact or opens a door for you. So that is something I felt that I had missed in dentistry in my clinic, because I was so into just my work that I didn't network, I didn't speak with other people outside the clinic. So it's so important to network and speak. Speak with all different people.
Networking is actually one of the stress reduction tools for dentists, because dentistry is it does this isolation on it. So how do you fight isolation in dentistry? You have to network. You have to surround yourself with peers. You have to have this brainstorming meetings. So that's a powerful tool of stress reduction in dentistry. Networking.
That is really important. And I heard a quote saying what success is, that I like, and that I mean, it's so funny, because I feel like I could have like a lecture about 20 things you shouldn't be doing. that mistakes I have done, during all these years. But most of the mistakes are towards myself. But one of them is the quote I like: success is balance between work and social life. And I didn't have that. So yeah.
I remembered something when you said about the things that you can make a list of things that you don't like. Hello. You can make a list
Hello.
of things that you don't like, but it's related to yourself. I think that's very important when you work with people, is that to be aware of that you don't fall into give advices, because advices are for you and it's based on your experience. So, and people have all their own rhythm, all their personality, like you said. We are all wired neurobiologically and neurophysiologically in different ways, and we really should respect that, because something that works for me might not work for you. It's like in meditation, I have that all the time. When I start a process of teaching meditation to someone, and it's something that it really has technique, and so I observe this thing of, but I have to do it in the morning. And then they have this chaotic morning because they have kids, and then they have to be in the clinic at this time. I mean, meditation will not work if you are worried that you're going to be late in your day. So it really, again, it has to serve you, not you be slave of the practice. So it's very important for us to remember that it's always a personal journey. It's always a personal development. And it's very tempting for us to go into give advices, based on our own experience, because we've been there. But this came also from one of the first courses that I did on mindfulness. I first did an introduction courses to mindfulness, and then the 8 weeks mindfulness-based stress reduction as a student. So this was, again, 15 years ago. And I remember that one of the first things that the teacher said was, if you can take anything from this course, is to not give advices, to learn to not give advices. And I was like, what?
Wow.
and that's something that I even have here in my office, as a sentence to have this intention: don't give advices, because you're giving advices from your perspective, right? And we are all so different, and that's what's so wonderful about us. So it's very tempting to do, but it's also something that I learned how not to go in that way. But that does not mean I don't do it. I still do it, and we all do it. So it's
Well, one advice I think we can one advice I think you can always say, it's that listen to your own inner voice, because the answer is there. It's like it's guiding us, but sometimes we just don't listen to it. What do you
that
think?
comes from the disconnection that we have. I mean, when you say that to certain people, they don't even understand what you are saying. I mean, they understand it in a rational way, but they don't understand it in the physical way. So the somatic experience is very important. And the experience that I have with dentists is that they, especially the ones that work for a long time, they are so disconnected from themselves. So they just work from their neck up. So they are very rational. They only trust their mind. That first they have to be able to connect that awareness of the body. So first they have to go back to really connect with the body, and that's why one of the first meditations that we teach in mindfulness is the body scan, which is just body awareness. And then you can, because that inner voice that you are talking about, you feel it in your body, so it translates in your body. Sometimes people feel it in their gut, someone's in their chest, someone's in their throat also. But it's something that if you are completely disconnected from your body, you are able to understand it rationally, but you are not able to recognize it in a physical way. And that work that you are saying is not that simple, because first you have to create body awareness, then you have to really start to recognize that voice and where it expresses, and then you have to build the confidence to follow that voice. Because I work with many dentists that at a certain moment they are able to be aware of that voice that you are talking about, so that the inner guide, because what you are talking about is the inner guide. But then you have to be able to work on your internal dialogue for you to be able to trust that guide. And that's the self-compassion part, which is very, very important. But I think that dentists are highly intuitive. I think intuition is a superpower in dentistry. And if you really learn to recognize that inner voice that you are talking about, it will take you to a different level in your profession and in your life. So I really, for me, intuition in dentists is a superpower.
Yeah, but you're totally right about that. That I mean, the first 10 years I was disconnected with myself. I didn't feel any inner guidance. I was just like focusing on work. But my body made me wake up. It was like my body told me, hey, now you listen to me. It's like, I want your attention. So for me, it was not longer a choice. For me, it was that my body showed me signs that you are not okay. And now you have to calm down. And that forced me to listen to my inner voice. Yeah. So
it was exactly my situation.
What would you tell
also,
your
my body
younger
failed.
self?
I would tell her to be your own best friend, because I was my worst enemy. I didn't treat myself well. So I would tell my younger self, you are your own best friend. Be your own best friend. Treat yourself right.
It's like, in the airplane when they say, first you give oxygen to yourself, and then you give to your
yourself,
child. Put the mask on yourself. And that is such a truth in every situation. If we give ourselves love and happiness, you can give so much more to other people. You can be a better professional. You can be a better wife or husband, mother, father. If you don't give yourself, you don't have enough to give to anybody else. And I really see burnout and energies like the mobile, that we have 100% energy, but then it gets lower and lower and lower. We have to think about recharging that to balance everything. When we don't recharge, it will just lower, and that is when bad mental health comes in.
Can I just say one thing about that? Because what I see on dentistry is that I completely agree with what you said, but I think that what dentists sometimes don't understand is that for you to recharge the battery, you have to do less. You have to stop doing so much, because sometimes dentists want to recharge and keep on doing the same things, and to those same things they add up the meditation, they add up the physical activity, so they think they need to do more to charge the battery. It's exactly the same. I usually say to this, you cannot dentistry your way out of this. So no, you have to really change your mindset. And to be able to recharge that battery, you have to do less. It's actually about doing less, with good boundaries, with saying no to, because if you're going to keep saying yes to things that you don't want to, your battery will be drained. Even if you have a mindfulness or meditation practice, even if you have a good physical activity, even if you eat well, you will continue to drain your battery. So you have to have good boundaries. You have to work on your boundaries. You have to be strict with your time. You have to, of course, have time to rest, to relax. That's where your creativity comes from relaxation, from connection with nature, for example. But for the ones that are listening, this is very important, because you cannot dentistry your way out of this. So you have to really change your perception. And for you to recharge your battery, you have to do less, not more. It's not a to-do list, actually. It's a way of life.
Yeah. And it's an everyday work. This is not that one day you realize all this it's every day we have to be aware of these things, and
even because your life
we should
changes.
have like
even because your life changes. I mean, if you now are able to do the things that keep your battery always full, like you were saying, right? In 2 years, you might be in a different completely situation. You might have kids, or you might you have to adapt. You have to really continue to adapt your life in order to make conscious choices that serves you better. But again, if you don't have that connection, if you're not aware of what serves you better, of what you need, it's the vision that you want for your life. This is very important also. Then you'll always be that feeling that you are not in control. We always go to that metaphor, right? The rat in the wheel. And that metaphor comes of the feeling that you are not in control. So you can only be in control in your life if you are really aware of where you are right now and where you want to be in 2 years. And once you reach that point in 2 years, you have to do the work again. You have to see, is this serving me now? So it's a daily process. It's the art of remembering. I usually say one of the first colleagues that I worked in 2018, one of the first courses that I worked with this colleague, and he sent me a message and he said, Manuela, I saw that you were doing this courses. I don't know what it is, but I need something. And I have a lot of messages or emails with messages with, this is the same message. I don't know what you were talking about, but I need something in my life. And at this point, it's mindfulness or voodoo or else they are up to everything, because it's a suffering point, like we were saying. But I remember this colleague because he was in the university with me, and so we have a very special connection. And he did the course with me, and he was able to change so much. And every time we talk, he said, it works, but it's every day I have to remember myself. Every day it's a work in progress, and that's it. Because mindfulness, actually, it's the presence that you bring to your life moment by moment, So, and for me, for example, what it brought me, it's like, I remember reaching the end of the year, not remembering what I've done and now I fully remember. It's like, I remember exactly the moment when I saw you on Instagram, I remember because I'm present, I'm there, I'm engaged in what's happening. So that brings another dimension to life.
Exactly. But it's a little bit the situation I'm in now. I took a plane to be with my mother. Few years ago, maybe I would not do it because I couldn't leave the clinic. We're so focused and at being for our patients that we even forget our closest loved ones, we have this high work moral, or many of us dentists, I guess, it's such a high work moral that you go even if the world is falling. I remember getting the news that my cousin had died on a Tuesday at 7 o'clock in the morning. I put my loops on my Google so the patients wouldn't see that my eyes were so swollen. And I went Tuesday, Wednesday, Thursday, Friday, because it was summertime. So I was the only dentist on 2 clinics. So I went on these 2 clinics because I couldn't cancel a patient. How can you, when I'm thinking back to that, can you imagine what like how detached I was? That I was not allowing myself to grieve because I already had the autopilot role for pleasing everyone. So I mean, it's
also
now
putting yourself
this happened 2017.
Mm-hmm. I was saying it's also putting yourself in a place
years
where you have no choices.
I realized. Yeah.
You put yourself in a place that you don't have choices. You know, I have to go. I have to do this. And that's very, and you don't even question that if there is another way of doing things. So, and that's why I think this is very important.
Exactly.
This conversation that we are having to raise this awareness that it's normal to cancel appointments. It's normal to not feeling well, and when you're not feeling well, the first thing on your mind is I don't want to do this. How can I do this? But I have to do this. Something is wrong. It's a big red flag, and we have to really normalize canceling appointments, canceling not being well at that time. Because if you go and if you're not well, then it will pay a very high price in the future. So it has to be normal, you know, cancel appointments. Dentists cancel appointments. We had the guest on the podcast, André Maris de Almeida, that he said something that it really stuck with me. He said, rock stars are canceling world tours, you know? So why cannot dentists cancel appointments? Cancel appointments.
Wow.
Normalize that. You are not well.
Wow. That's deep. Only you're saying canceling appointments and I feel my heartbeat.
No, but
it's crazy.
Because you have anxiety due to that. It's a trigger of anxiety. But you should, that's why this conversation is so important. Let's normalize cancel appointments. You are not well. Your patients will do it. If they are not well, they will not come. They don't care about you.
Yeah.
And I bet that if you can choose, if you choose to a patient, I always give this example. If a patient can choose, do you want a dentist to take care of you that is well and healthy and happy and enjoying what you do, or you want a burned out dentist that is there because he has to and he's feeling completely drained and exhausted? Which dentist do you prefer to take care of to do the procedure on your mouth, to extract your wisdom teeth?
Exactly.
I mean,
exactly.
And it's the same thing about you. If you go to do a minor surgery, which professional do you prefer? A well-rested professional, a person that is there present and engaged in what he's doing and it's enjoying what he's doing, or do you want an exhausted professional? Which one do you prefer to have the minor surgery, to perform the minor surgery on you? So cancel appointments. If you are not well, don't do that, Christina. You hurted yourself. Huh? You hurted yourself.
Yeah. So that was 2017. So now, like 6 years later, my mother, her health condition is worse, and I'm like, life is, I lived a life like video game that, okay, when I die, then I will do the things, you know, like, but this is our life. This is our life, and we don't know how long time we will have our loved ones, and we just have to live in the moment, live in the present, and enjoy and be happy. And but the thing is that people in general don't know about this problem in dentistry. And of course, it's not, like we said, it's not only in dentistry, but people don't think about dentists in that way. And one day I thought about a relation between sharks and dentists. What is a common thing between sharks and dentists? We are afraid of sharks, we are afraid of dentists, so we don't think about the emotions because we are so afraid, we are so focused on our own fear. And that also comes to when you Google dentist depression, you have to search a long time until you really come to information about depression that dentist has, because the first 20 pages are about the patients, the fear and anxiety the patients have and how it affects the oral health. So everything is so focused on the patients, and that even makes it worse for the dentist. I remember during the phases when I have been in a darker place, knowing what I want, why I felt bad, I was searching for information because I mean we are scientists. We in dentistry we are so used to search for information. So I was searching symptoms, and it really I had to search a lot. And I was also searching for people as you, Manuela, who dared to speak up, dared to take up. So I found Dr. Kyle Stanley that you also had on the podcast. And he had an hour-long YouTube video that I love. I really recommend, where he also speaks about this. And he had the other day a post, dentist has emotions too. Did you see it on Instagram? And the thing is that we are a group that is forgotten and we are proud. So it makes it even more complicated. But by speaking up today, we open up the conversation, because life is beautiful and life shouldn't be so complicated.
Yeah, yes, I totally agree with you, and I think the conversation is already opened, and we have to continue to speak about
Yeah.
it. And one of it was very interesting what you said, because one of the major transformations that I witness on my course is when dentists actually realize that the stress does not come from the patient, because we always look, like you said, for the patient's emotions, right? Either is anxiety or suffering pain, financial stress, whatever. But it actually, the stress comes from the way that you react to those emotions. So and I still have a lot of colleagues that when they hear what I teach, the first question is, is that for helping me deal with anxious patients? It says for helping me with anxious patients during appointments. As you know, the course is for you. It's for helping you deal with your emotions when you have anxious patients. So and yes, we are so focused on the patient and on serving and good technical service, right? And to perform at our best, that we do not realize that we are always reacting to the patient's emotions. So, and we project, we think that our stress comes from the patient and the anxiety and the things that the patient says. And but it's actually not. It's the way that we react to those emotions. We're not aware of our triggers. We are not aware of our pulse raises every time the patient says to us, "Oh, I hate dentists." right? And immediately I remember when I start watching myself to my triggers, I remember that every time I hear this sentence, oh, I hate dentists, that my pulse raised it. I had this, immediately my body temperature also raised. I started to have like this knot here that raised to my throat and blocked my throat, because then again, based on empathy, I was not able to express anything. I was just making this fake smile. So immediately my muscles in my face were activated. But you don't realize this because you are an automatic pilot. But the stress comes from that. The stress comes from your body immediately that producing the adrenaline and cortisol, and you react based on your amygdala. Only if you start develop the self-awareness, you can stop, you can be aware of the because emotions are information, emotions are expression, they are expressed in our bodies. So this becomes, you stop identifying with the emotion and you become the observer. And then you can really bring a more evolved answer, because you can bring a response based on your cortex and not on your amygdala. And again, I love the physiology. I could talk for hours about this. I'm completely passionate. I remember, just like you said, going back when I started my mindfulness course, but what is the reason of this, how this works, and going all of this. So, and this is why this kind of courses, everything works so well in dentists, because you have the scientific ground for this. This is really this is that all based on evidence. So, and when they start in my course, for example, I always send the articles, the scientific articles that support every exercises that we do and everything. And it's like, okay, this makes sense, because we need to understand it in our minds also. Otherwise, it's just like this woo woo, and they're not very in there yet.
For me, it's like I said, I didn't listen to my body had to make me listen to the signals, because I was so autopilot and with a high working moral. So the last burnout.
But are you aware of those signals nowadays when you work?
Yes.
Of your triggers, of how that makes you feel, because
at least, I yes. Most of them, but I so what you said about the cortisol, I mean, during a dentist working day, we got these peaks of cortisol all the time without even noticing it. We see a patient that is anxious, that gives us, like, we know how emotions are how do you say, affecting us. We know that it's energy. You see a happy person, you get happy. You see a sad person, it affects you. So if you're even a high sensitive person, so you feel it even more, you will have these peaks all the time. You feel they're anxious, and then you have to
and it's not only about
to give
that,
100%
Christina.
all the time.
It's not only about that. It's because also dentistry has a lot of it's very complex. So even if you are not if you are a highly sensitive person, of course you have that connection with the emotional part. But even if you are not, then in the dentistry you have late patients, you have a lot of material that cannot work, you have finances, you have to do very technical, complex work in a limited time. You do several of those during your day. So you have a lot of stress factors in dentistry. Plus, if you are a sensitive person, of course, also. But even if you are not, you have all of that. What this causes, all of this stress factors, is just like you said, there's always constant adrenaline and cortisol in your bloodstream, and that's because the sympathetic part of the autonomous nervous is always activated, which is or basically with time this origins overactivation of the sympathetic, and the parasympathetic, which has the smoothing part of an action, we start to not it doesn't do its work, because there's the overactivation overactivation. So this is basically neurophysiology. And I usually, when I go speak in some place, I always make this question: when did dentists forget how to close the stress cycle? Because we learn the physiology of this in the university, but we forget it because, again, we are an automatic pilot. So we do not close the stress cycle. There's an overactivation of the sympathetic, but we never intentionally bring we have to learn, and that's one of the main things why mindfulness works, is that this is basically the physiological mechanism of mindfulness. It activates in an intentional way the parasympathetic arm of the autonomous nervous system, and you close the stress cycle. There's no magic here. So what the parasympathetic does, it's takes out the cortisol and adrenaline of your blood, and you can relax. Even when we reach the end of the day, we don't relax because we are thinking of work, we have our family, we have to do this, we have to take care of that. And that will lead you, of course, to exhaustion and burnout. So this is not magic. This is science. But this works. But what dentist needs to work is to activate intentionally and close the parasympathetic and close the stress cycle. But you have to learn how to do it. Huh? You have to learn how to do it. This is technique.
But so because I had this stress, constant stress, and because I felt that I loved it as well. I came home, I continued with work, before and after photos, editing, marketing, Instagram. So I never stopped. What happened was, when I was sleeping, I got fight and flight symptoms. Can you imagine sleeping or having siesta a Saturday and waking up like a lion was chasing you? So that
I know
symptom,
that.
I got that. Hey, so it's incredible. That is when I really realized that, because I knew it before the cortisol, but that got so clear.
But
and it's nothing to joke about. So
imagine that the lion is actually chasing you. Imagine that you escape the lion and you feel safe. What's the first thing that we do when we escape such a danger?
I've never been running from a lion. But the first thing when we escape...
Imagine that you had an accident, or you escaped an accident, you know? Or that you have a fire and you are able to get out. What's the first thing that we do when we feel safe again? We do this. Right? And that's the parasympathetic. You relax, your muscles relax. So the thing is, you need to learn to relearn how to relax, because that's what you need. That's what I say when you need to do less, because you need to relax. This is when you escape a lion, or when you have an accident, or when you have a fire and you are able to escape. Your body does this in a natural way. You have to stop, because it's the adrenaline rushing out, it's the muscle. So this is closing the stress cycle. The problem nowadays is that those lions that you felt that you were escaping are emails, are bills to pay, are anxious patients, are patients running late, is the chair that don't work, is the lab running late. And we have a lot of lions, and we don't give ourselves the opportunity to even when we reach home, because then we reach home, we have treatment plans, we have social media, we have family, this, and it's just to-do list. Even, again, taking care of ourselves is on our to-do list. We even wake up at 5 o'clock in the morning because we are supposed to. That's why high achievers do. You don't have to do anything. You have to relax. You have to... because there's no lion. Exactly. There's no lion chasing you. You are safe. You are safe, but you have to keep on repeating that to yourself. Because when I start saying this to myself, we are safe, this was only here, I didn't felt it in my body. It's like I was lying to me. Am I safe, really? No, you are. You are safe. Put your hand on your heart and tell to yourself, there's no lion chasing me. I'm safe. I'm allowed to rest. I'm allowed to cancel appointments.
I had, for example, the clinic mobile mail on my private mail.
Big mistake.
And I stopped that because, yeah, but that's why I told you, I have done all the mistakes I have had, because this phone number I have had for 18 years as an urgent clinic mobile number. So a lot of patients have it. I can sit Saturday morning with the coffee and a message comes. And I noticed, the thing is that the more you listen to yourself, the better you becoming noticing the signals. So I could notice how a small thing, a message could just trigger again the lion chasing me. And that could be a message when I was supposed to have my coffee and I got triggered in a way. So I realized no clinic mail on my mobile. I have to detach myself because of the person I am. I wish sometimes I could be a less sensitive person, because I know I'm a little bit maybe exaggerating, but I have been thinking about this a lot. And there are two groups I think would consider, I'm not saying that nobody shouldn't be in dentistry, but there are two groups I consider definitely not the psychopath, because that dentist will remove the teeth and put an implant just to think about the money.
I don't think that's a psychopath, but okay, I think psychopaths are different. I don't think you can classify that as psychopaths. But okay, I understand what you're saying, but I think it's a little bit dangerous to classify that as psychopaths.
Yeah, I don't know. Doing a thing that you can't replace just to have a better economy, I think that kind of person is really dangerous in dentistry or any health industry.
Everything has more than one perspective.
Area.
I mean, there's this new trend nowadays, for example, that on biological dentistry, that there are dentists that don't believe in endodontics because they feel it's bacteria in your body. So I mean, there's always a perspective on everything. Yeah, it's very dangerous to put things in boxes.
No, but No, of course, that could be a theory, but I mean, for example, removing a total healthy tooth. Mm-hmm. I mean,
I understand. Yeah, but
yeah, but and then I think that there is a personality test that I really like. The name of that personality, it's about 16 personalities.
It's probably the Myers-Briggs
have you heard of it?
Test? Yeah. Mm-hmm.
Yeah, I think it's that one. I really would advise young persons or people to do that test, because that is really, I have never seen such an accurate test. When I read the result, and the thing is, I did the test a few years ago, but a week ago it came up in my pictures because I had done a screenshot or something, and I read it, and it was so accurate with my personality type.
Mm-hmm.
And yeah,
I just say something, Christina, to wrap it up, because it's already long for the ones listening. I think that the career choices that you made, and that you can now identify all the mistakes that you made, but at that moment in your life, they made sense. You know, it served your purpose at your life. You wanted to build your clinic. Yeah. It was a goal from you. You wanted your clinic to strive, you know. So it makes sense. At a certain moment in our lives, it makes sense to overwork, you know, to be overcommitted, to there's a time for everything. I think that it's very important also to have the awareness at a certain moment to see, okay, I made these choices, but now I'm in a different place, and these choices are no longer serving me. They are causing me stress. So what can I do to change? But in order for you to be doing that, it's also very important to forgive yourself, Christina. I think you need to also to forgive yourself, to find that place on your heart that said, these choices serve me at that time. It's a lot of work, and I made a lot of people helped a lot of people. So and also it's because it's not it's we evolve, we become different people. When you say I changed a lot in the last 12 months, I'm sure you changed a lot in the last years. I mean, you're a completely different person that you were 5 years ago, 10 years ago, and it's like because I've been there too, you know, to really not understanding why I was doing this to myself, to a point that I hurted myself, you know. But at the time it makes sense, and for me it took a lot, and even how, the way I treated myself, you know, the way I was my own worst enemy. That's why I said that if I could speak to my younger self, I would tell you are your own best friend. Stop looking for connection with others and connect with yourself. But I had to really be able to forgive myself and to make peace with myself, and that helped me. Actually, I cannot recommend it enough, the work of Christina Neff. She has a beautiful book on radical self-compassion, and I cannot recommend enough self-compassion. There's a lot of courses of self-compassion, but you really, I think for dentists, for us to be able to find that place on us to forgive ourselves from, because we hurt each other. And that's why we find so many excuses on others. You know, it's the patients, is this, is that, is that, is that. No, it's us hurting ourselves. At the end of the day, it's that happens. No one else forces you to do nothing. You force yourself to go to work every day. You force yourself to all of that. So there's a lot of that part. That's why every work that every dentist does, and stress reduction, or whatever is the tool that you develop, whatever works for you, because we are all different. There's a lot of tools nowadays that you can choose from. I always advise to do also psychotherapy or self-compassion work, because it needs, if you don't find it in yourself, the place to forgive yourself for doing that to yourself, it's always going to be incomplete, the work. You're always going back to that place of oh, but why did I did this, or what, and you know, and you always the internal work to be able to achieve that peace with yourself. That's very important, and to be able to understand also why you did it. And sometimes you don't even have to understand it. You have to just forgive yourself and acceptance. Not resignation, but acceptance will teach you a lot, and will take you a long way also.
That I totally agree. It's very important. It's very important to forgive yourself. And I have a vision of life that I think I don't regret anything in my life, because I think we have a path, and I want to think that there is a meaning with everything. There is a meaning that we have been through what we have been through, to be able to speak up and to be able to help other people. And that road, as you say, it's important to forgive ourselves and think, okay, what can I learn from this? To not do it again, and to help other people. That is what I feel. I think we have been through all the questions, even if we haven't looked at everything. But we have been through so many different subjects. Thank you so much, Manuela.
Thank you, and congratulations!
What do you have
on doing this, and having the courage to speak up, on having the courage to, and it takes a lot. It takes a lot of courage, and it's not easy for us to
no
to expose ourselves this way. I know, and it gets easier with time.
It's not easy.
But congratulations
that's what you
on
are saying
being so brave.
Is really important. Thank you. And I want to say to the listeners that it's not easy. It's not an easy road to do this, what we are doing. I have been through hell in my mind. Will I say, will I not? Will I say, will I not? I'm like, will I not? Will I keep it to myself? But if I'm in silence, we're not getting anywhere. And the people who are going through difficult times will have it even worse if they don't hear it from another person. Because when I have heard another dentist saying what I have felt such a relief. It's like, somebody else felt like I'm feeling. I'm not crazy. And that is a feeling. You are not crazy. If you have these feelings, if you're feeling bad, there is always a way. Don't give up. You're not crazy. It's totally normal. It's because you are human. We are flesh and blood, and we are no robots. You know what? I will end the podcast with the story that is a real story. And maybe it will sound crazy, but this happened to me last time I was here in Greece, when I was in a dark place and had to find myself and my happiness. Normally I'm a happy, people always, oh, you're always a happy, good vibes. But during that month, I was not a happy Christina. And I started to force myself every day to walk by the sea here in Greece at my mother's. And in the sand, there were never any seashells, very few, it was always these rocks, these small stones. And one afternoon, I didn't really want to walk, but then I thought, yeah, I will, because I know I will feel better later. So it was a sunset, so it was just a short walk. And suddenly I saw this beautiful cloud that was it had like a light, but the sunset was on the other side. So I was looking at this beautiful cloud, and I took a photo. And another woman took a photo, and I was like, yeah, okay, it was very special. And I walked a few meters, and I saw this huge starfish in the sand. And I remember that I got tears, and I felt like, maybe this sounds crazy, but I felt like this is a gift for me from, it has like a meaning. I took the starfish, and I could see that it was dead because it didn't move, but it had just come from the sea because it was still moisty. And I didn't have any Wi-Fi, so I couldn't Google when do I know a starfish is dead, or should I throw it, or should I keep it? But I felt that it was dead, so I kept it. I went home and I Googled the significance in the starfish. And the starfish stands, first of all, it says it's like a celestial gift. And I had just seen this cloud and it stands for change because it has two sides. It stands for intuition because it doesn't have really eyes. Every arm works like intuition. Follow your intuition. And you always have an opportunity for renewal, because you know that the starfish, if they lose their arm, a new one grows out. And even if they just have a small piece of themselves, they can just have an arm and a whole body grows out. So, it felt like such a symbolic thing. So I kept this starfish and I have it in front of my desk at home to remind me we can always, by following our intuition and happiness, we can always, renewal and change and make something new. And if people believe that, I think we will have, in general, a better mental health by knowing that just by following more what you really love. When are you feeling flow? When are you feeling happiness? Try to stay in that environment, in those emotions, and doing more of that. So that happened in autumn, and that was, I felt like something beautiful will come from this. So that it was when I started to walk that path. And Ozan Varol, that wrote Think Like a Scientist, he said something that I really want to share as well. You don't have to see the whole path to start something new. You just have to see a few steps and start walking. There will be bumps, but the path will show itself. And that is what I want to, the message I want to
think it also helps if you have a clear vision of what you want. If you have a clear vision of what you want, the path also, because if you don't know where you're heading, then maybe you will get there, but it will be a bumpier road. So, but definitely, thank you for sharing. Thank you for sharing that, and thank you for sharing your story. And you're doing beautiful things. And I wish you all the best. I believe in you.
Manuela.
And if I can help you with anything, please. I'm always available, and very happy to see you smiling and to work with that drive and motivation.
We will do beautiful things. Thank you.
Thank you,
so much,
Christina.
Manuela.
Thank you.
Thank you.